Good evening, everyone. Today we'll discuss some 10 MCQ based on recent MCQ in NEET, SS, and FET. I'll discuss total out of 5 questions each: cervical cancer and endometrial cancers. So I'll discuss some of the questions. Okay. So first is MCQ is all the following are the risk factors for the cervical cancers except. So OCPL it is usually it is protective in case of cervical cancer, but it is a risk factors for endometrial cancers. Okay, endometrial cancers. Next is hypertensions, and cigarette smoking it is it will reduce the risk of it has the risk factors for the cervical cancer, and if you give chronic immunosuppression that will cause HIV infections and HPV infection that will indirectly cause your risk factor for the cervical cancer. So basically the answer here is the hypertensions. It has no correlations with the cervical cancer. Cigarette smoking, occipitals, it is, although it has some cases occipit also has a risk factor for the cervical cancers. So answer is hypertensions, not all except. Next questions. With the following this statement is wrong. HPV infection was detected up to 99% of women with squamous cell carcinoma. Yes, it is correct. If you go for a survey, if you go for a squamous cell carcinoma of the cervix, the HPV infection was detected in up to 99% of women. Okay, next point is there HPV is the causative agent in both squamous cell carcinoma. Yes, HPV is squamous cell carcinoma, HPV 16 and 18s, adenocarcinoma of the cervix, but they have different carcinoma. Yes, they have a different carcinoma because adenocarcinoma is different carcinogenesis and squamous cell carcinoma also had a different carcinoma. There are the 100 different type of HPV vaccines, HPV virus. Out of that, more than 30 of which affect the lower genital tract. Yes, it is correct. The next statement is mechanism of carcinogenesis of HPV is by inhibition of p53, because p53 is a tumor suppression gene. No, this is tumor. It has the property, it will prevent the DNA damaged DNA, correction of the damaged DNA, so that the mutation will not happen. That is the property of the p53. If you suppress, if you inhibit, that will cause tumorigenesis or carcinogenesis. The same thing is the RB gene, the interaction of virals E6 and E7 proteins. Here also you should not stimulate. Here the answer is it will be inhibit RB genes. Okay, that will the answer will D. The third questions. The 65-year-old woman comes to for a follow-up few months after your surgery for carcinoma cervix. On evaluations, she is found to have a recurrence of the malignancy. So which the following statement is true regarding the recurrence? Most common site of recurrence is pelvic lymph node. It is correct statement. The mortality in patient with recurrence, what is the common cause of mortality is due to the pulmonary embolism. Yes, this is the correct statement. In the CA cervix, the pulmonary embolism chances is high, so that will cause recurrence. In the recurrence patient, the chances of death mortality is due to pulmonary embolism. Usually treatment involve surgery. You have to, because pelvic lymph node recurrence is more, so you have to do surgery with lymph node dissections. And the recurrence tumor with target diameter is less than 3 cm has a good prognosis. Yes, this statement is correct. Statements are wrong. These are the wrong statement. Only this statement is correct. Next, 50-year-old man presented with postcoital bleeding is diagnosed with cervix stage 1B. 1B, you have to go for a radical hysterectomy, that is type 3 radical hysterectomy. The fourth question, the contraindication of radiotherapy in ACA cervix except. PID young patients, you should not give radiotherapy. If there is vaginal stenosis, that is also a contraindication. Adenocarcinoma or adenosquamous carcinoma is also a contraindication because it will not respond that much to radiotherapy. Associated, if you have associated prolapse or ovarian tumor, you should not give radiotherapy, that will be contraindicated. But postmenopausal status itself not a contraindication for radiotherapy. The sixth question is, you are planning to administer monotherapy radiotherapy to 50-year-old men with diagnosis C cervix. What is the dose to be given? Point B and point A. Because you know point A has to, this is the point A and point B will be here. So point A and point B 2 centimeter above and 2 centimeter above and 3 centimeter laterals is point B. So point A is here 2 centimeter above and 2 centimeters laterals. Then from the point B is 3 centimeter lateral to the point A. So always try to remember point A and B. So you have to give, point B has to give less pelvic radiation so that the surrounding vessels, everything will be less radiation exposure. But point A has to be give more radiation exposure, that 8,000, and point B will get 6,000. Okay, that is the answers. Point B will be less, that is 6, and point A will be 8,000. Very, very important. Next question on the endometrial carcinoma. 65-year-old men undergo endometrial carcinoma, pathological examination, surgical specimen tumor in the rectal cervical stroma. There will be no myometrial invasions with substantial LVSI with a non-aggressive histological type. Which of the following the most accurate 2023 figure stage for a cancer? You know, stage 2A, stage 2B, stage 2C. 2A is only the cervical stroma involvement. Stage 2B is the non-aggressive histological type with the substantial LVSI, that is stage 2B. Stage 2 is focal LVSI. Stage 2B is non-aggressive type. Then always the stage 2C is aggressive histological type. So answer will be stage 2B. 72-year-old man with endometrial carcinoma undergo staging CT scan. So this scan revealed multiple level lesions, suspicion nodal left lower long, needle biopsy, liver confirmed metastatic carcinoma. So you can use metastatic endometrial carcinoma, liver metastasis. So beyond the pelvis, abdominal distance metastasis in endometrial carcinoma is stage 4B. Okay, and the 4C is the bowel bladder mucosa. This is metastasis. 4A is bowel bladder mucosa. Which is the following statement wrong regarding the prognostic implications of positive peritoneal cytology in endometrial carcinoma? Positive peritoneal cytology in the absence of other evidence of extrauterine disease has no significance, effect on recurrent survival. So basically, if you only positive peritoneal cytology, there will be, with any absence, there will no other extrauterine disease, there are no effect on the recurrence in survival. Next statement is correct. This first is correct. Then second statement is the positive peritoneal cytology in the presence of other poor, if along with positive, if positive cytology plus other poor prognostic indicator, that has no significance. This is a wrong statement, because if you other evidence of extrauterine disease, that will cause a significant recurrence or survival. Okay. Third statement is correct. Use several therapeutic model has not resulted in any proven benefit in patients positive. Actually, the positive peritoneal cytology, there will be no therapeutic benefit if you give radio chemotherapy, and the positive peritoneal cytology in the presence of other evidence, that will cause significant recurrence. So basically, positive cytology alone, that is a no recurrence, no significant recurrence or no survival. But positive plus along with other evidence of extrauterine disease and plus extra risk factors, that poor prognostic factor, that will cause significant difference in the recurrence or survival. The fourth questions with the following statement is false. Endometrial hyperplasia is 5 to 10% with postmenopausal bleeding is correct, and the less than 10% of patients with postmenopausal bleeding have endometrial carcinomas is correct. The risk of there will be a risk of endometrial carcinoma is greater in postmenopausal women. That is, this is 10 to 15 times. It is not. It is 18 to 4 to 8 times in the postmenopausal women who are receiving on-pause estrogen therapy. The diagnostic accuracy, the office-based endometrial biopsy is 90 to 98% when compared to the subsequent finding diagnostic hysteroscopy is 90 to 98%. This is the correct statement. The last statement, correct statement about endometrial hyperplasia: 30% of patients with atypical endometrial hyperplasia on endometrial biopsy or curated specimen will have an associated, usually well differentiated endometrial carcinoma detected during hysterectomy. This is correct. Simple hyperplasia is 8 to will progress. Now, simple hyperplasia is just to progress only 5%. This is a wrong statement. Most hyperplasia has a low rate of regressions. Is correct. Most of the low rate of regressions, not correct. Atypical hyperplasia 1 to 3% regression rate of cancers, wrong. So basically the 30%, if you go for a hysterectomy specimen, you can detect a typical hyperplasia. Endometrial biopsy corrected specimen which is usually well differentiated endometrial carcinoma during hysterectomy. Thank you. If you like this content, please subscribe.